Hi, did you know that during the 2016-2017 influenza season, the flu vaccine prevented an estimated 5.3 million illnesses, 2.6 million medical visits, and 85,000 hospitalizations associated with influenza, according to the Centers for Disease Control and Prevention, the CDC. Another study published in 2018 showed that getting a flu shot lessened the risk of a severe flu among adults and also reduces severity of the illness. So, hopefully you will gain more knowledge about the annual flu vaccine and understand how and why they are beneficial as I provide credible research information on the issue. I will be explaining why the annual flu vaccine should be mandatory to attend public schools, including colleges and universities. They should be mandatory because the annual flu vaccine is the best way to help protect against the flu. The CDC successfully vaccinated nearly 11,000 healthcare workers with the seasonal influenza vaccine in 29 healthcare facilities throughout the country via Vietnam. Although the flu vaccine can be ineffective some years due to researchers predicting the wrong strain of flu to make the vaccine for that year, it is still very beneficial and recommended to receive the annual flu vaccine. My first statement is that influenza is a potentially serious disease that can lead to hospitalization and sometimes even death. Every flu season is different, and the influenza infection can affect people differently, but millions of people receive the flu every year. Hundreds of thousands of people are hospitalized, and thousands to tens of thousands of people die from flu-related causes every year. The annual seasonal flu vaccine is the best way to help protect against the flu. A flu vaccine is needed every season for two reasons. First, a person's immune protection from vaccination declines over time, so an annual vaccine is needed for optimal protection. Secondly, flu viruses are constantly changing. Flu vaccines may be updated from one season to the next to protect against the viruses that researchers suggest may be most common during the upcoming flu season. This is from Key Facts About Seasonal Flu Vaccine. Now that I have established the necessity and reasoning why the flu vaccine is so essential, there was proof in Vietnam that the vaccine helped and saved lives. Between January and May of 2017, the Ministry of Health of Vietnam, MOHV, with financial and technical support from the Partnership for Influenza Vaccine Introduction and the U.S. Centers for Disease Control and Prevention, successfully vaccinated nearly 11,000 healthcare workers with seasonal influenza vaccine in 29 healthcare facilities throughout the country. The vaccines were provided by CDC's Influenza Division through a cooperative agreement with MOHV. Following the administration of the vaccine, a survey of randomly selected healthcare workers in 13 of the 29 healthcare facilities showed that the vaccine program was well received. In addition, when monitoring for adverse events following the immunization, it showed that there were no severe side effects. This was from a success story called Vaccination of Healthcare Workers in Vietnam and with Seasonal Influenza Vaccine. However, flu vaccines are largely ineffective most years because researchers often guess on which strain of flu will be prevalent that year. Also, flu vaccines result in dangerous side effects and for a small percentage of people getting the shot, mainly due to health or age-related circumstances. It is very hard to predict the exact strand that will circumvent the year, but it is also possible for researchers and scientists to predict the wrong strand of influenza for that year. Also, it is possible to still receive the flu even after vaccinations, but mainly due to the ineffective research or that person was already exposed to the virus shortly before or during the vaccination, since it takes about 2 weeks for the body to develop the protective antibodies in order to fight the infection. This is from Key Facts About Seasonal Flu Vaccine. As mentioned before, annual flu vaccines should be mandatory to attend public schools, including colleges and universities, simply due to the fact that the annual flu vaccine is the best way to help protect against the flu. The CDC saved 11,000 healthcare workers in Vietnam. Regardless that the flu can be ineffective due to researchers predicting the wrong strain of flu for that year, it is still very important to receive the vaccine and is very easy to receive at any healthcare facility. It is always better to be safe than sorry. Even if it is possible to receive the flu after vaccine, at least there is a chance of immunity and protection due to the vaccine instead of just not getting it at all. This will help protect our schools and public areas, especially colleges and universities, because there are so many people on campus at one time that it is very easy to spread the virus to multiple people in that public environment. Most people refuse to get the vaccine because they do not like needles, but luckily they provide a nasal spray, which is less painful and helps weaken the virus and prevent severe symptoms. So, go get your flu vaccine as soon as possible at your local care facility to help save your life and your friends and family's lives. Thank you.